home edition of the Douglas County Board of County Commissioners meeting. We want to welcome our attendees and our guests today. We're going to start today's business meeting with an Earth Week proclamation. And I'll go ahead and read that proclamation unless any of the other commissioners would like to do that. Okay. Whereas in the unprecedented time of a pandemic and evil, as we keep close to our suffering of those who are ill and who have lost loved ones, the sacrifices of all healthcare, public service, food, and grocery service, and other essential workers, and the devotion of individuals and families taking care of each other. We pause and also recognize the caring tradition. Whereas this year is the 50th anniversary of the first Earth Day, and when millions of Americans took to the streets, college campuses, and hundreds of cities to protest environmental ignorance and demand a new way forward for our planet. And in the years since, Douglas County government, businesses, and residents have echoed this appreciation and called to action. And whereas we are all stewards and beneficiaries of the earth and its healthy and diverse ecosystem, it is vital to a vigorous local economy. And whereas we recognize that the conditions that followed the COVID-19 pandemic to be as harmful and as terrifying as it is are the same conditions that allow for ecological collapse and climate change. The people who are most vulnerable are the same people who get hit first and worse by the impacts of climate. We must use creativity, innovation, and education to solve these problems, with local communities leading the way by embedding equity, encouraging sustainable energy and water use, sustainable land use, and waste reduction, reuse. Earth Week offers people an opportunity to make, renew, and celebrate commitments that will protect quality of life and the earth for generations to come. Now, therefore, be it resolved that the Board of County Commissioners in Douglas County, Kansas, hereby proclaim the week of April 18th through the 25th as Earth Week, adopted this 22nd day of April. I did jump over really quickly our some guidelines for our online meetings. We started this, like I said, the third one. We do ask you to be patient with us, but we're getting smoother each week. A few reminders about how we'll run our meetings at this time of stay-at-home and social distancing. If visual aids are used during the meeting, the presenter will share the screen with the call. Participants will not be able to view them with a computer, smartphone, or tablet. All participants will be being with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their lines when not speaking, and introduce themselves each time they speak. If you have a public comment on an agenda item or under regular public comment, please use the raise your hand function of Zoom. Staff will call on you and unmute you. We ask the speakers give their name and address for the minutes. The county reserves the right to shut off that microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. The chat function has been disabled, and a recording of this meeting will be available on our website after each meeting. All right, with that, we will move on to our consent agenda. Is there any item on the consent agenda that a commissioner would like to have removed from the consent agenda?
No.
No.
Any item on the consent agenda that any member of the public would like to speak on? Anybody there, Sarah? No. Jill, any hands raised? Okay. Seeing none.
I don't see any, sorry.
That's okay. Do I have a motion to approve the consent agenda items 1, 2, 3, 4, 5, and 6?
Move to approve.
A
Second.
motion to approve and second. All those in favor say aye. Aye.
Aye.
Thank you. We'll move on to our regular agenda item, which is our 2020-21 healthcare plan recommendation. And I believe we'll turn this over to Sarah and Michelle Spruer. Is that right, Sarah?
Yes, thanks, commissioners. I think Jill's going to run the PowerPoint for Michelle for the presentation. I do want to remind commissioners that we had a work session on this topic, I believe April 1st. It seems like a long time ago, but so on the future of our plan, this will be for our specific 2020 and 2021 healthcare plan recommendations. So at this point, I'll turn it over to Michelle.
Thank you, Sarah. Can everybody hear me? Okay.
Yes.
Do I?
Yes.
Okay. Do I need to share my screen then, or?
Michelle, you're going to have to give me just a minute. The file, I just got the file and I'm trying to send it. So give me just a minute. I haven't been able to get, oh my goodness, sorry. I haven't been able to get it to my webmail yet.
We'll stretch for you. We got
Okay,
this.
sorry.
That's okay. I would say I can share my screen as well. So.
So Jill has up the memo now.
Yeah, this is Michelle still. Actually, I'm still waiting for the PowerPoint file to come through to my desktop. I'm sorry.
This is the memo. I have the memo shared.
Okay.
Thanks.
You know, Michelle, I let me see if I can. I might hold on just a second, Michelle. Oh, hold on a second. Michelle, you're a co-host now, so that means that you should be able to share your screen now. Give it a try one more time.
Okay. Let me give it a shot and see what I. Okay. Is everybody able to see that?
Yeah.
There we go. Just
Awesome.
go. Thank you.
Okay, so yeah, this is all new to me. I walked in the commission room and Sarah told me to leave. So like Sarah said, a couple of weeks ago, we reviewed year-to-date healthcare numbers. You know, we talked about kind of long-term goals, you know, what we wanted to do to help make this plan financially sustainable. So tonight, I'll just talk about the recommendations for the 2020-21 plan year. So with that, Willis, our benefit broker, Willis Towers Watson, they've projected an 8.5% increase in total plan cost. So your total plan cost, that includes all your claims and all of your vendor admin fees. To cover this cost increase, you can, you know, do it with a combination of funding, which is county money, it's employee, and you can do it in plan design changes as well. So, you know, benefits that are provided through the plan. I'm going to go over some recommended plan design and funding changes. The recommended plan design changes, they are balanced between savings and added costs, so it's kind of a wash. So it's kind of nice to be able to add some benefits to your plan. But and my phone cord keeps hitting my mouse, so I'm sorry. The funding recommendations are a 6.9% increase in county funding, 185.17 increase. Total funding $8,993,812. Likewise, we would recommend a 6.9% increase in employee and retiree contributions. I don't know if I need to, since I need to read every single one of those. But you can see the increases. It would be a $5.21 a month increase to individuals, actively working. And then employee plus one would be a $20.38 increase per month, and then family is $29.13 per month increase. And then for retirees, we're looking at a $31.26 increase for individuals, $61.13 for retiree plus one, and then if they have their family, it's an $87.38 increase per month over 2019-2020 plan year. Plan design, we would recommend a $200 increase in deductibles, so that would make it $700 individual, $850 for a family. A $400 increase to the out-of-pocket maximum, which would be $900 out-of-pocket maximum for an individual, not to exceed $4,850 for a family. No changes to the dental plan recommended, no changes to prescription copays or out-of-pocket maximums there. So the next couple of slides, they talk about plan design changes. Some of these changes were in the stuff that I presented on April 1st. So these are the changes in plan design that would result in a savings to the plan. So moving to clear health strategies for out-of-network claims repricing. So when members go out of network, providers, they don't offer a discount. They're not contracted with Cigna, so there's just no discounts built into the pricing. So we have those claims repriced. There's fees for doing that. There's formulas to come up with reimbursement amounts. Changing to clear health strategies, they have a kind of a different tool formula, I guess, that they use for reimbursement. And then their fees are less. So this could result in a savings of around $174,000 annually. Implementing the best-in-class or the BIC optimizer with MedTrack. Again, I talked about this, a few weeks ago. This program steers members to specialty generic drugs, offers them a $0 copay for those generic specialty drugs, while it also reduces the plan cost. So the potential savings here is $13,000 from that switch. The next, I'm going too fast. The next thing, so these are plan designs that would give some extra benefits. Some of these recommendations can have a significant impact on the health of our employees and to help avoid cost. Something else I talked about, when you're making changes to covered benefits, cost avoidance is a primary reason to consider changes. So adding coverage for hearing aids, this would be subject to deductible and coinsurance. The max benefit would be $2,000 every 3 years. So not a large cost item, but a highly valued benefit, I think. Potential plan cost would be $20,000. And again, these potential costs that we're talking about, Willis seems to get, you tend to be pretty conservative when you're estimating costs. You don't want to underestimate. So I would say most of these numbers would be worst case scenario, if you will, in any given plan year. Adding coverage for obesity related services, so nutritional counseling, up to weight loss surgery. There's guidelines set forth by the medical industry as to who would qualify for this type of surgery. There's criteria in place that one would have to meet to be eligible. Like you have to go through 6 months of a physician managed weight loss program, or and in that program you would have had to have lost 5 to 10% of your body weight before you'd be considered for surgery. And so Trustmark, our TPA, they have contracts with a medical team that would review any surgery request. So there's steps in place to limit the plan's exposure for this added cost. So it's not something, this is not a surgery anyone can just go out and get. So those things are in place to help control costs. Incentives for members that are actively engaged with TRIA Health. So actively engaged would mean that you have regular check-ins with a clinical pharmacist. So A1C testing with no member copay. So diabetics, you know, you want diabetics to go in and get that testing. It's not overly expensive, but being compliant with those testing. Respiratory, diabetic, blood pressure, and cholesterol meds with no member copay. Those are some of the highest used medications on our plan. There's lots of generics out there for, you know, for some of these conditions. So again, not a huge cost item. The member, you have to maintain the active engagement to receive the incentives. Potential costs would be anywhere from $32,000 to $42,000 a year. You know, again, this is a big impact on cost avoidance. You know, I've said it before that non-compliance is extremely costly. And non-compliance is not always due to the cost of the med. A lot of times it could be drug interactions or the efficacy of a drug. If I have more than one doctor prescribing meds, you know, maybe they don't interact well together. These clinical pharmacists, they are actually PharmD, so they're doctors of pharmacy. That's what they do. They help these members get on to the right drugs, so you don't have a catastrophic event down the road. So, you know, a little bit more detail, I guess, in the memo. It gets a little wordier, but that's really all I had as far as recommendations. So I don't know if Sarah has anything to add or if there's questions about the recommendations.
I don't have anything to add at this point, just to kind of stand for commissioners' questions.
Hi, Michelle, this is Michelle. I have a question about the coverage for obesity-related services. Can you give me a little more information on that? I mean, that's a pretty big cost increase and pretty wide margin of $83,000 to $125,000 extra a year. I mean, is this something that our employees are really interested in, or?
Well, I think probably not so much the weight loss surgery, like the nutritional counseling, and like if you have a diabetic who also has been diagnosed with obesity. You know, they go in to get, you know, some blood work done, whether it be A1C testing or, you know, just some other blood work related. And if the claim is sent in with a diagnosis code of obesity, it's denied. You know, if it's sent in with a diagnosis code of diabetes, it's approved, or, you know, it's processed and it's allowed. So, you know, the nutritional counseling is probably the big one. A lot of doctors' offices are offering management programs that are managed by that doctor's office. You have regular check-ins. You know, those right now those claims would not be covered. So it's helping members make those lifestyle choices to become healthier. And I mean, and again, I think the weight loss surgery would be a last resort, you know, a lot of times. So that is a big margin. You know, that's what, you know, Willis runs information through their pricing tools. And this is what they had come back with, so.
You know, one thing I would add to this, and this is Sarah, is that we try to evaluate, and one of the things I ask Willis every year is how does our plan stack up in terms of what we offer compared to other similar plans? And so these recommendations, particularly in obesity-related services, come from, you know, there are other plans of similar size to ours that do have coverages for these things. And so I think it's just important that our plans stay comparable to other plans, and these services are becoming far more common as a covered expense. And if folks are able to address these issues, you know, we're able to have a lot of plan savings in the long run.
Okay, and then just one more on the hearing aids. I mean, I know that people of all ages need hearing aids. It's not necessarily retirees. which a lot of people would think. And pricing hearing aids, $2,000 every 3 years isn't really a lot. So I'm wondering, once again, how much that additional cost to our plan, how many people is that really going to impact and are really going to have that need? And is that basically $700 a year over a 3-year period really going to, how much of a difference is that considering the cost increase for all plan participants?
Michelle, let me start with this one if I could. You know, what I would say is that when I do think we get asked from time to time about this one, and we have a pretty minimal vision coverage in our plan. And this to me is similar to that. We cover glasses, so I'm not quite sure why, vision correction, I'm not quite sure. As someone, I have a family member that has a hearing aid and they are pricey. So I don't think that this will be, this will just help offset some of those costs. And I think we care for vision, we also care for hearing impairment. And then the rest of those costs would have to be borne by, the individual needing the plan. And so I think that, we thought that this was a small nod to be able to help those folks with that kind of important life event thing.
And adding the hearing aid benefit, no matter how big or small it might be, it opens up access to a discount program that Cigna has. Even though we don't contract directly with Cigna, because we use their network, we would have access to this plan. I think I can't even remember that. I think it's called Amplifon. Amplifon might be the name of it, but it opens up some discount program that $2,000 could go even further for folks using this discount program.
Okay, thank you.
You're welcome.
I'm going to ask Denise Mills to share a little bit about the hearing aid coverage. We want to make sure everybody gets some feedback. Denise, if you yourself as well.
Hello, everyone. I'm Denise Mills. I'm a director with Willis Towers Watson in the Health and Benefits Division of North America. Good one. Most of our clients honestly do not offer hearing aid coverage. A few do, but I really think that based upon the type of industry that you're in, you've got police, you've got firefighters, and they're subjected to a lot of noise that a lot of us are not. I think this is a great step in addressing the fact that you care about your population and that you're trying to help mitigate cost to them. So we're fully in favor of this. I think that taking maybe some baby steps in the type of coverage that we offer, let's see what this does, and we'll monitor it and model it out for future.
Thank you.
You're welcome.
Thank you, Denise.
Sarah, have you had a chance to be a little challenging in this, but in the past we've had some time to get feedback from staff, and we'll have some public comment here and maybe some staff members will chime in, but do you have any feedback for us on that?
Yeah, Michelle hosted a Zoom webinar that had a great participation from a number of employees and and then we also did department heads could have been on that, and we also had a separate presentation at our department head meeting. I think everyone was supportive. It was good to have a good year. I mean, compared to how Douglas County has been the last couple of years, this is a great pretty good renewal for us, considering our last couple years. So I think folks were, and they've generally been supportive of, as we increase deductibles and coinsurance, so that the folks that use the plan pay for the plan, and also as a strategy to help keep premium equivalents as low as possible. And so they did have a chance to review it, and you know, we had asked lots of good questions and we got a lot of good feedback.
And I'm going to guess that you got to the 6.9% because that was the balance, you know, where employees picked up some of the cost and retirees picked up some of the cost, and the county. Is that how you got to that percentage?
I would say that I would say that we asked, like we've done in the past, we've asked Willis Towers Watson to present us with a couple of options that balance plan design changes in terms of copays and deductibles with just put it on the premium. And I think our intent here was to try to keep premiums as low as possible, and try to move those costs to making a more consumer-driven healthcare. So.
Denise, did you want to chime in on that?
Denise, you need to know that anything you put in the chat, we're going to have to repeat to the public.
Okay, I apologize. I just wanted to speak to the fact that the minimal change that we're making to the out-of-network claims, you know, we're estimating large savings dollars, basically takes care of all of these enhancements. You know, we did an analysis and we did it at, you know, minimum and maximum, and at max you're going to save 20,000, at minimum 50. So, you know, I think that you're making really, really strong decisions. I think the bariatric surgery options and the nutritional counseling are really good. You're more at a leading edge type of facility, but you know, obesity really equates to about 40 different chronic conditions. So I think this is really a good start, and I think it really shows that you are a leader in the community on how you want to combat expenses going forward.
Thanks for answering. Any other questions before we take public comment?
I don't have
No, I'm good. I think they look like really good, progressive and thoughtful changes, and it does seem like it's kind of a wash in the end financially. So.
All right, so we'll invite public comment at this point. Just a reminder, if you're on the Zoom call, you just need to raise your hand and you'll be ushered into the Zoom talking room, whatever that is. And Sarah, is there anybody there at the courthouse?
No, I don't have anyone here for public comment.
Okay. Jill, is anyone raising their hand for public comment?
Not seeing anyone raising their hand at this time.
Okay. Seeing none, we'll come back up to the commission for comments, motions, and votes.
I don't have anything else. I'm willing to make a motion if we're ready.
I'm ready.
I would just say before we make that motion, we're trying to address some factors that may lead to higher costs. And, you know, the obesity and the diabetes work here, I think, shows a trend towards wellness. But before we have a motion, I do want to ask Sarah to give us a little bit of an update of what we might see in the future. And maybe Michelle, maybe that's better guided towards Michelle. You remember last year we talked about, you know, a higher deductible plan and making some, you know, having some conversations with staff. Can you just sort of tell us how that's going and maybe what's your timeline for that?
Well, okay, just making sure you can hear me. Sarah may have some feedback too. You know, not being able to get in front of employees with face-to-face open enrollment meetings was that kind of deflated me a little bit. I was, you know, really looking forward to getting out there and talking. We are setting up some Zoom calls like this with departments that want to do open enrollment that way. I think we'll be getting around to lots of staff meetings with departments to kind of talk about. And for me, the biggest thing is education, educating employees on what stop loss is. You know, they've probably heard that term before, I'm sure. Maybe they have no idea what stop loss does. They don't know what a self-funded plan is and what that looks like. And I think first educating people on how much it actually does cost to run this plan is a really good first step. And then you understand, I think, more why you're making the changes you're making and why deductibles go up. I think putting in a health reimbursement account, you know, I talked about it a few weeks ago. You know, a health reimbursement account, it's more of a consumer-driven plan. It would give people a chance to save up some money and make and think about where they're getting their health care and think about, you know, do I go to the ER or do I go to urgent care? You know, things like that. So I think there's going to be a lot of conversation, you know, once we're all able to get back together, so to speak, you know, on this education. So
Yeah,
I don't
and
know if that answers your question.
And I would just add, you know, it is the goal of our of administration, and based off the feedback from the Board of County Commissioners, that we will move our plan next year for the 2021-2022 plan year to a different plan model. So we can't do that. I mean, we can't have that education right now, but we can certainly have it in the fall, and we will make that move towards that transition. I'm committed that we can continue to make that work happen over this year in some fashion so that we can make that change next year.
Thank you. I just sort of wanted a quick update on that. I want employees to hear us that we haven't forgotten about. I mean, we're very fortunate with the percentage increase. It's very different than last year. Last year, it was a big number that we were looking at.
And we did have that was part of the Zoom call that we had with employees, was talking about moving to a different plan model. And part of so I think employees know that they've had a lot of changes in the last couple of years, and they're going to continue to see changes moving forward.
Thank you. All right, I'm done pontificating. Michelle, if you wanted to make your motion now.
Okay, real quick, I want to say thank you to Michelle and Sarah and everybody that worked on this, because it's always a huge task annually under normal circumstances. And to be, you know, working on it this year, and we'd talked about changes and everything. So I'm sure there were additional challenges, but I appreciate because I think it looks great. So I would like to move to approve the recommended option 1 for 2020 to 2021 healthcare plan funding and plan design changes, as well as 1-year renewal with Trustmark.
Second.
A motion and a second. All those in favor say aye.
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 All right. Thank you, Michelle. Thank you, Sarah, for your work on that.
Thank you.
Do we have any appointments? I don't believe so. Okay. We don't have a lot of meetings now, so not as many appointments, I suppose. General public comment. This is the space where we provide general public comment. If you do have a general public comment you may like to make about an item that is not on our agenda, we invite you now. If you're on the Zoom call, you need to raise your hand and we'll move you into the magical Zoom talking room. And if you're in the courthouse, let Sarah know. Anybody there, Sarah?
Nope.
Jill, anyone?
Nope.
Okay. Count me disappointed. And now we'll move on to Commissioner Administrative Miscellaneous items. We usually do this. We start with Sarah.
Thank you, Commissioners. You will note you have a weekly memo back in your agenda packet that we added. We have been able to get our management intern, Daviana Humble, working remotely. And so she has pulled together a weekly memo for us. It's pretty bare bones this week, but I hope to be able to add more to it as we're able. There are some really important updates, what we're hearing from our legislative folks in terms of some of the revenues and just what they're planning for, perhaps for a veto session at the legislature. So I'd encourage you to take a look at it. I did want to give commissioners a bit of just as we've been doing the last several weeks, a status update on our unified command for our COVID-19 response. Things that have been really proud of the work that we've been able to do as a community to come together and to meet the challenges put before us as a result of this incident. There's a number of exciting developments happening that are really showing how we are able to we've been able to flatten this curve, that people are doing what we asked them to do, which is to maintain social distance and to comply with the governor's stay-at-home order. Public Health is going to be standing up a new testing site on the east side of Lawrence starting Monday. There's a press release coming out about it. And they have the appropriate testing supplies to be able to manage that testing site. Not unlimited, but they've got enough to be able to manage a new site for testing. There are expanded criteria for testing, so there are fewer restrictions that people need to go to meet those testing requirements. So we're encouraging folks that think they might have symptoms to contact their physician or Heartland Health or Public Health and to do that. We had a great response to the Public Health Epidemiological Survey that was sent out last week. Over 11,000 people in Lawrence and Douglas County completed that survey. Public Health will be beginning to monitor those survey results and then do additional surveys to have a better sense of how our whole community is feeling during this process and what kind of symptoms people might be feeling. So that's great. The hospital has just been doing tremendous work on a variety of fronts to be prepared for this and working through this crisis. They have begun a process to re-sterilize N95 masks for the hospital themselves and for our first responders. So that'll help stretch our PPE a little bit further. Donations are still coming in from the community and from other providers. So, and that process is being managed by United Way and then the logistics team out of Public Health. So that's really encouraging. We are continuing to receive some shipments of additional supplies from what people have ordered, and we feel pretty confident as to where we're at in terms of those supplies. We continue to we've added some objectives about how do we plan for a long-term recovery out of this incident. And I'm excited to be able to begin to transition some of our thoughts and energy to how do we, being out of just the moment of this crisis and really trying to plan for the future. So I'll be bringing more back to you about that probably within the next week or so as to how we proceed out of that. And I just kind of stand for any questions that you might have related to our response or anything I can help answer for commissioners.
Thank you, Sarah. Any questions for Sarah?
None from me.
No, I don't have any questions. I can't stress how much I appreciate you keeping us up to date and in the loop, because it's so difficult to not be able to come in there for our weekly or a couple times a week, just pop in or normal meetings with you. But you're doing a great job of, I feel at least, keeping me up to date and in the loop of what's going on. And So thank you. Some days I feel kind of helpless sitting out here in Zoom land, just, putting up yard signs, because it's the only thing that makes me feel like I'm actually doing something, because it seems like you and our health directors and public health folks are all kind of carrying the load here for us.
I appreciate that. I do think that there are a lot of people working really hard on this and putting forward a lot of effort. And I'm just, we are really working together really well. And I'm incredibly impressed with how we have really kind of hit our stride on how to approach this. Our ability as a unified command to make some decisions and push things forward has been great. We've had some great conversations about grants and financing this last week. Trying to optimize what sources of funding can be used for what particular piece of this. And so that's really good to hear. Everyone's just been so cooperative in this process. So I think you'll have more to come on that. We're just really now starting to get bits and pieces from the state and feds on what things we can apply for and what would be best fits for that. So we're going to be bringing forward some additional recommendations to you about what particular items we can support with grant dollars.
Commissioners, I thought I'd share with you a couple of things. Each week I sit in on a call from Governor Kelly, and I will tell you that most of the items that I'm sharing with you now, things are just moving so fast that it seems out of date by the time we actually get together and can talk to each other. I do share my minutes from the meeting with Sarah, so she is aware of them. But just a couple of things maybe also for the public. I think you may have heard that they're now 3D printing swabs. And so KDHE is wanting to communicate again that they're not hoarding items, and that oftentimes testing materials are being directed to other states. And that's had a big impact on their work they shared with us. Also, we heard from FEMA, and they continue to work on finding more and more PPE. They have recognized that food pantries are a concern. And I have had some conversations with Sarah about making sure that our food pantries are well stocked. So I was glad to hear that the state is aware that that is a concern. A lot of the time is talking about Department of Commerce and those SBA loans and those PPP loans. That got a lot of press this week. So I think a lot of people understand that they ran out of money in those loans and that they're working them through. I would encourage the public to really access the kansascommerce.gov website. They're encouraging small businesses to reach out to their lenders if they're really struggling. I know I've heard from some folks, and maybe some of you have too, but to reach out to their banks and talk through that. What is something they can do? That the banks do not want them to default on those loans. And so working through that. We also hear from the Department of Labor each one of these meetings. And I'm sure you are aware, and so is the public, that they are having a hard time keeping up with the number of unemployment claims that they're getting every week. They've changed to something called gated calls, which if your last name is A through M, it's Sunday afternoon, Tuesday, and Thursday. They'd like you to make your claim. And if it's N through Z, it's Monday, Wednesday, and Friday. You can read all about this on the Department of Labor.kansas.gov website, but I think they're really trying to get some things online. They have a new pandemic unemployment assistance system. They didn't seem to know that PUA was not a good name for a system. I was surprised by that, but they shared a lot about that. And then Governor Kelly went through all of her executive orders. So I'll give you little updates on that each time, just to keep us sort of all in the loop on what we're hearing from the governor's office. And I will also share with you that I was really pleased that the chair of the Johnson County Board of County Commissioners reached out this weekend. And we're actually, and this is news for Sarah because it just happened today, we're actually going to have a little Zoom call between some of the area mayors and county commissioners. It's not to decide what we're going to do. We're not making any decisions there, but I think we're just interested in hearing from each other what plans are as we start to roll off from stay-at-home orders. We'll then take what they share with us and share it with Unified Command. I did have to share with them that we're a little different in Douglas County and that our health board acts independently. And that was news to Commissioner Eilert, and that's fine. But I think we're just in a little bit of a different situation in Douglas County with the health department, that the health board is not Douglas County, the Board of Douglas County Commissioners. So I'll share with Sarah after that meeting and she can take whatever we learn, but I'm glad to, I really appreciate our neighboring counties. This is not something that has a border that we can keep into our specific counties. So it's nice to hear us talking together and at least understanding the decisions each individual entity is making.
Yeah, that's good to hear. You know, we have a lot of people here that work in Johnson County and a lot of people from Johnson County that work here in Douglas County. And I know we don't have a lot of control over it, but I know that early on in this, one of the things we ran into was, you know, they shut everything down right before St. Patrick's Day. And then we were open for business. And I know a lot of people from Johnson County came over here and celebrated St. Patrick's Day. So it's, you know, there is no big magical fence that can keep people in or out of a county or an area. And so working together is really important. That's good to hear.
And Patrick, I just really appreciate the extra time you're taking and the leadership that you're providing and kind of representing all of us as you do that. So thanks, given everything else you're needing to do as well. I know it's a lot to put on your plate, but thank you so much for representing us.
I'm glad to do it. If it gets too much, I know I can lean on you two to help me out there, but you know, the timing of those calls with the governor is Friday afternoons, which works out pretty nicely. And because I can have a nice beverage in my hand and take good notes. And it's interesting, we don't get to talk on those calls because that would be a violation of open meetings. And so it's just sort of like listening to a fireside chat with Governor Kelly and her team there a little bit as she explains what's going on. So yeah, I know that you're there, and I hope I bring back good information for you. I think it's just really critical that we work together. We work with the state, we work with our counties and our cities, just like we're doing with Unified Command. And that's how people keep saying that we're going to do this together. And our job is to serve the people of Douglas County, and that's going to require us coordinating with other entities as well. So kudos to everybody, Sarah and your team. Great job. I do want to ask the public to slow down. It seems like we've seen on those maps that are coming out from KDHE that we are not social distancing to the rate that we were recently. And, you know, if we can all recommit ourselves, I know it's really hard and we all want to leave our homes, but for the health and safety of the public, and I know there are conflicting views on that, I get that, but I do think we need to rely on those people in lab coats to tell us the right thing to do here. And they're telling us right now to stay home. And so let's see if we can get that. I think we were at a D. Is that what I saw yesterday after being a B-? We need to, yeah, we got some homework to do maybe. Really, it's homework. Stay at home and do your homework. So if you can. Anything else before we adjourn?
I would like to challenge whoever's remaining on here from the county, Mask Monday. Post a picture on Facebook of you in your mask, and maybe we can get Carrie to share them and we can lead by example.
Great idea. And Sarah, thank you for organizing that and making sure all our county employees have those masks. That's really great. Okay, if there's nothing else, until next time, we are adjourned.
Take care, guys.